Let's face it, there's a lot you don't know about sickle cell disease.
Like that it affects almost all races.
Like that it affects millions.
That it can be unbearable.
That it's the most common genetic blood disease in the country.
But awareness and understanding are still far too uncommon.
Let's face it, there's a lot you don't know about sickle cell disease.
And that's a disease too.
Call the 211 info line to learn more.
Welcome to another episode of Face Sickle Cell Disease. My name is Virginia Pertiller. I serve as the Executive Director for a community-based organization named Citizens for Quality Sickle Cell Care. We're located in two locations. One is in Hartford, Connecticut. The other one is in New Britain, Connecticut. Today I have a wonderful guest with me, whom I'm going to introduce to you, and then she'll introduce herself. Her name is Teresa Works, and she's a woman that I can say truly does work very hard. Teresa, welcome to the Face of Sickle Cell.
Thank you, Virginia. That's a lovely introduction, and thank you for having me.
Oh, you are quite welcome. Just for our listening audience, would you please just share who you are and how you got to where you are today?
Yes, I'm a licensed clinical social worker in the state of Connecticut, and I have over 20 years of experience. I've been fortunate to work in a wide variety of settings over the course of my career: hospitals, community-based settings. I've worked with medical patients. I've worked with psychiatric and substance abuse patients. So the opportunity came up at Uconn a few years ago to work with sickle cell, and I thought it was a good time for me to kind of integrate a lot of my background and focus on the treatment and care of sickle cell patients.
That is great. That's a wonderful longevity of working with different types of clients, and now to be working with sickle cell disease. Tell me, what is sickle cell disease?
Sickle cell disease and sickle cell anemia are a genetic disorder in which the red blood cells become abnormally shaped. They become shaped like a crescent versus a healthy red blood cell is donut shaped without the hole and carries hemoglobin, which is an iron-based protein that allows oxygen to get out to all of the cells. When the cells are sickle-shaped, they do not effectively carry the oxygen to the cells, which can cause them to become stuck, and this can cause very painful pain crises for patients. It also can increase the risk of infection in patients and secondary disease like a vascular necrosis, in which the bones start to deteriorate because of the lack of oxygen. So it's a very painful disease, and people have both acute pain crises and can develop chronic pain from the disease as well.
Okay, so that really says that sickle cell is a sickle cell disease, or sickle cell anemia is a disease that affects the entire body.
It does, it does.
Because of the necessity of those red blood cells.
Yes.
You know, reoxygenating all of the vital parts of the body, inside and out.
Yes.
So, well, thank you for that definition of what sickle cell is. Why should patients get involved in a comprehensive center where they can perhaps get all of their services?
A comprehensive sickle cell team at Uconn Health Center is comprised of a adult hematologist, a physician, an advanced practice registered nurse, a RN, and the licensed clinical social worker, which is my position. We also have a medical assistant, we have a psychiatric consultant, and of course we collaborate closely with our community providers through the Citizens for Quality Sickle Cell Care. So the approach is a systemic approach. It looks at both the medical condition of sickle cell and its complications, as well as how the person is doing overall in their environment. How are they coping with the disease? How does this disease impact their life? And we then are wrapping around that patient and their specific needs to work with them in the community, in their schools, with their medical conditions, and to really address any barriers that there may be to them being well.
In your work with clients that come to you, now do you have many of the clients that attend this comprehensive clinic? Do they also interface with you as a clinical social worker?
Yes.
Oh, they do?
Yes. We have a weekly clinic in which our entire team is present, and as people come through, we all interact with the patient. Some may have greater social service needs than others, or some may present with more urgent needs. There can be financial issues, so in my role, I meet with them, kind of assess if there's any barriers that are occurring, if their insurance is in place, if there's transportation issues, and just how in general they're coping with the disease, and if necessary can schedule to meet with them individually and strategize with them on how to maybe manage their disease differently, or their approach to their disease a little bit differently.
So a lot of what you're doing then is navigating them through some personal things, as well as things that they could receive resources from the community as well.
Correct. My role is really to kind of work with the person and see what their needs are, whether those are concrete services, housing, transportation, medical insurance, additional community resources, which may be of assistance to them, linking them to the community agency if they need additional advocacy, as well as kind of working with them on the psychosocial emotional level to just see how they're coping, what is their resilience, what are their strengths, how do we build on that so that they're able to more effectively manage this disease.
That's awesome. That is very awesome. So now, when you have younger people transitioning in, do you find that the younger people are interfacing with you as well as readily as the adults that's already in your care?
Assisting the young adults and transitioning to the adult comprehensive sickle cell clinic is actually a focus of the comprehensive team. We do go on a monthly basis to the transition clinic at Connecticut Children's Medical Center, CCMC. We meet with the young adults as young as 18 and start to introduce ourselves, engage them, make them aware who we are. We schedule tours so they can kind of physically get oriented to Uconn before they come. And so, a huge part of our process is to ensure those young people don't get lost into the medical system, that they don't disappear when they age out of CCMC, and that they begin that engagement and that transition in a healthy and natural way. Young adults are at high risk of mortality if they are not linked to medical care. And young adults and teenagers often have this sense of immortality, that nothing can happen to them, and don't really understand once their parents aren't managing their health care, that they have a responsibility to be engaged in treatment and be well, and what that really entails with a disease like sickle cell. So
So do you find there's more resistance of the younger population of people with sickle cell disease engaging in your services?
I have not found necessarily resistance as much as I think the process of leaving CCMC for some of these young adults is a difficult process. They really are treated like children, and our expectation in an adult center is that they are adults, and you know, that their parents aren't navigating their health care. The patient needs to navigate their health care. So I think our expectations and the responsibility is a little bit different. So part of my role is to kind of help them understand that they're now adults and what their responsibilities are as adults in managing their health.
Are there certain skills that you help them to, you know, to develop more of as they become more on the adult side of the care?
I think I work with them to develop positive communication, to be assertive about their care, to work with the team if they feel that things are not being well managed, whether that be pain or the actual health services that they may be receiving at different parts of the hospital. So to kind of help them advocate in a positive way for themselves, as well as, you know, a lot of our young adults are in college, they're working, and so to help them have some balance between this disease, which can be very unpredictable, while they're being expected to do things that are routine, going to school, doing their homework, working, you know, taking care of their apartment, engaging in relationships. So.
And so those who are still, and I know there are some young people whose parents do a lot of advocating for them, and you know, they know the medication and the treatment plan. And I know there's a transition even there for parents to help their young people to, now you need to understand what you need to do, because they won't always be around. Do you do a lot of work in that area as well as helping the young people to kind of like cut the apron strings from parents to do their own independent care?
I think all of our team really does that, to kind of educate the parents and, you know, the younger adults that this is part of the transition. This is part of learning to navigate the healthcare system, is to know your meds, to know your pain, to know when to take your meds, to take your meds on time, to come to your medical appointments. And you know, we have young adults who are really good about getting to school and getting to work, and then they prioritize those because they want a normal life, but then they miss their medical care, which then can jeopardize everything else as far as their health. So, you know, part of working with them is to help them to figure out how to balance all of that so they can get their medical care, they can take their meds on time, they can get to work and go to school, and that we're part of that.
That's great. What is the scope? What is your actual scope? And I know you already spoke a little bit about the scope of work that you do, but as a role of the clinical social worker, what is your role, your scope of your services that you do actually?
Well, I think I mentioned kind of looking at both concrete and the psychosocial elements. So if patients are having any kind of issue, housing, transportation, entitlement issues, if they're having difficulty getting to the store to grocery shop, kind of helping them set up to maybe have groceries delivered, you know, just kind of being aware of what concrete resources helping people maintain their entitlements, accessing, you know, funding in the community that may help them, or any kind of concrete service. The psychosocial element is really my background as a behavioral health social worker. Assessing, you know, how are they coping with this disease? Are they having anxiety? Are they having depression? Are they irritable? You know, are they not sleeping well? And sorting out with them, you know, is this some of this physical? Is some of this mental? And what are some strategies to kind of manage those things? In addition, I presented last year at the national conference for sickle cell and the relationship between exposure to trauma and the development of chronic pain. And we're going to continue to do some research in that area going forward. We have a study that's going to be underway.
Could you expound on that a little bit more in terms of your findings, your initial findings when you did the study?
Yes, when I first started at the program, I was meeting with patients and really engaging them around concrete services. And as our relationship kind of evolved and they would start to talk, a lot of disclosure was happening about patients having traumatic experiences over their lifetime. And so we started statistically drilling into which patients have had traumatic exposures, how many traumatic exposures, what kind of traumatic exposures, and did they develop chronic pain? And we did find a strong correlation between the amount of trauma a patient has been exposed to and the development of chronic physical pain. So our research is going to look more in depth at that data and more comprehensively at that to see if we have other ways to manage, manage the pain on the emotional level. Then that may really benefit our patients down the road.
That is awesome, and I'm sure that people would want to know and hear more about that as time. So I'm hoping that as we continue these segments that you'll come back and really share with us the conclusions of your findings.
That would be my
from
pleasure.
That research. We're going to kind of wrap up right now for this segment, but we'll come back. We have been speaking and talking with Teresa Works. She's a clinical social worker with Uconn Comprehensive Adult Sickle Cell Clinic. And so we will come back again, and I hope that you will stay with us as we go back and discuss some more things that Teresa Works is doing on behalf of sickle cell disease. Thank you for being with us, and please stay for the next segment.
How do you judge a law firm's success? Cases won, money made, or what the firm does in the community? At Dressler Strickland, we know that success is just the beginning. The true measure of success is what you do with it. For 33 years, we've used our success to help our neighbors and our community. 24/7, 11/22. Whenever you need us, we'll be there. Dressler Strickland, building communities one case at a time.
Welcome again to another episode of The Face of Sickle Cell Disease. I hope that you heard the last segment, but if you did not, you're still in for a great treat. We're talking and discussing today with Miss Teresa Works. She's a clinical social worker, and she's just finished giving us some awesome information about her work with sickle cell disease. So welcome again, Teresa Works.
Thank you, Virginia. I'm so pleased to be here today.
Oh, you are I'm glad to have you.
Thank you.
We're going to start talking about what advice would you give clients who come to you later on in life who have been diagnosed with sickle cell disease?
I would advise all patients with sickle cell disease to, if at all possible, get their care at a comprehensive sickle cell center. Many patients transition to us from comprehensive children's services, comprehensive sickle cell centers and children's services, but adult centers focus on the whole person, and it's really important, even if a patient has a mild form of the disease, for them to be monitored by a comprehensive sickle cell team, because sickle cell is a pervasive disease. It affects many of the organs, the bones in the body. It can cause many, many secondary issues. It can cause strokes, spleens, infarcting, avascular necrosis. So even if a person doesn't have chronic or acute pain episodes, the disease may still be impacting other organs. So the comprehensive team will then coordinate the care, the medications, and refer that patient to other specialists and manage the disease, both the present and the hidden elements of it. So patients may be referred to renal, to pulmonology, to cardiology, to ophthalmology, and their care will really be well coordinated, and even the maybe not latent, all of the elements of the disease will be managed in a more effective way.
Right. So being at Uconn Health Center, which has all those fields of health provision, is an optimal place to be, because you don't have to go all over the place to get services. So that comprehensive-ness is not just within that clinic, but it's the entire hospital.
That's correct, Virginia. We are really fortunate. We will work, we will connect patients to primary care and to other resources. We communicate actively with those providers to make sure that there's follow-up, whether that's with the Coumadin clinic if people have developed clots, or the cardiologist, the pulmonologist. There's active conversations about the patient's care. In addition, we can access the course of the visit and the assessment through the electronic health record. So we have instant access to those providers' notes and can explain things to patients if they have questions. So it really is a wonderful system for patients to be connected with.
That's pretty awesome. So if a patient is out there and do not have a comprehensive clinic to go to, they're probably all over the place in terms of services for their health, whatever the health need that they may be looking for.
Many patients don't understand the benefits of having a comprehensive clinic to get their sickle cell care provided at, but that care coordination is really, really essential, whether we're coordinating with an orthopedic because of the avascular necrosis, and then managing the pain because of the hip or the shoulder being necrotic, or the sickle cell pain. It really is a benefit to the patient to have that communication so that different providers aren't treating different things without talking. And it's done very, very fluidly, and it's patient specific. So the needs of the patient are assessed. And then that care is coordinated across the system.
I think that's pretty awesome. That is a very awesome thing. Let's go into how does the social worker help clients, patients manage their pain?
My role with Uconn is I follow patients throughout the system. So if they come in for outpatient courses of care, I meet with them in the clinic. If they are inpatient because of either sickle cell crisis or secondary infection or complication, I meet with them on the inpatient side. I also may meet with them in the emergency room if they're coming in and unexpectedly, or if they're in the infusion room getting a transfusion, or having a pain episode that's being managed. So working with the patient, it can be as simple as when they're inpatient, helping them plan for discharge so that they have appropriate services in place, helping them navigate and advocate for their care inpatient if they're having frustration because they're ill and they don't feel good, and they're having this pain episode and they don't feel that their pain is being managed aggressively enough, kind of advocating for them. But it's also dealing with the emotional aspect. Many of the patients not only have acute pain, but have developed a chronic pain. And chronic pain can lead to patients feeling frustrated, anxious, depressed. There's a strong relationship between chronic disease and anxiety and depression. So some of that role that I do is to help people manage the anxiety, manage the depression, and the unexpectedness and unpredictability of sickle cell disease.
Okay, well, I really want to talk about the experience of depression as a part of sickle cell disease. How are you seeing that come through, play out in the lives of people with sickle cell disease?
As I said, when people have a chronic health condition, sometimes the focus can be on the unexpected or focus on the pain as it relates to sickle cell. And people are frustrated because it disrupts their lives. They can't participate in normal activities. They miss income because they've missed work. They are always behind in school because they've missed classes or have been too sick to turn in assignments on time. So they miss social events, they miss family events. So it can be a challenge to live with this disease. Some of my role is to help people not focus just on the losses, but on the strengths and the resources that they have, and to kind of help them shift their perspective a little bit so that they are using different skills and coping in a way that is more resilient.
And I'm sure you see this, Teresa, that many of the clients that that we work with sickle cell disease are very talented and
Yes.
very gifted people, and I don't know if what happens through having sickle cell just really zones them in to develop so much of what I see as just wonderful gifts and talents. Do you see that?
I do. I think, we have, very, smart, educated, talented writers, painters, just a real diverse group of patients who are very, very creative and kind of, helping them to engage in that creative process and supporting that as a kind of an outlet has been part of the work, to keep them focusing on positive things.
I think it's pretty awesome. As a matter of fact, today I shared with you that one of the patients had made a necklace for me and wanted me to make sure that I wear it and think of them as I wear it. And I think it's just awesome when I see that kind of talent and that kind of gift and intelligence that comes through. And so that depression that sometimes people feel is sometimes not even about the disease. Sometimes it's about how people perceive them out in the community.
Yes.
You want to speak about that?
I think there's a misperception because the manifestation of sickle cell disease is these pain crises and the treatment for the pain crises is for patients to come to the emergency room, come to the hospital, and have pain management, which is usually with opioids. It really is the only treatment for the pain. And we educate our patients to have a pain plan. We personalize a pain plan with them, and we ask them to advocate for themselves and identifying what is the plan that works for them. Unfortunately, some providers perceive that as drug-seeking behavior or perceive the patients as being opioid dependent, when in fact they're actually being taught to advocate for themselves to get their needs met.
Yeah, so I think that some of the labels that have been put on people living with sickle cell disease has been very demeaning.
Yes.
And I think that the lack of awareness and understanding about the disease, the perception that people have is so warped and so way out of order for so many of them.
Yes.
That sometimes when seeking resources and services, it's like it's not in the right place.
I agree.
Let me put it that way. It's just not in the right place. So although this disease it's invisible, if you know that they have it, and if you know anything about it, you don't discount when they say they have pain.
Correct.
Okay.
And pain is, very subjective.
Yes.
It's not something that you can look at a person and always tell what their level of pain is, both acute or chronic. So really the way to treat the pain is to elicit, from the patient their perception of the pain and the type of pain they're having, and then, as a provider to treat that pain. So.
I agree. Well, let's talk about the. Do you see a high rate of addiction in patients that you see, clients that you see?
That question occurs a lot, and I actually see less of a rate of addiction in the sickle cell patients than I do with, kind of a normal everyday population. Most of the sickle cell patients do not want to take pain medication. They don't like the side effects. It makes them itchy. It makes them sedated. They can't concentrate. They are people who are living kind of normal lives. And the pain medications, for many patients, they don't like to take them. They don't like the side effects. Some need to take them, but they don't necessarily like to take them.
Yes.
They're also very closely monitored because there's a huge responsibility in prescribing these medications.
Absolutely.
So, if patients are calling in early for refills, we have to respond to that. We have a responsibility to the patient to make sure that if their pain isn't well managed on the meds we're prescribing, that's evaluated as part of their course of care, and other options are evaluated. So I think it's both, like I said, the perception. You would think because so many of the patients are on opioids that we would have a higher number of people who are drug dependent, but we've actually had very, very few patients who have been.
That's awesome. That is awesome to hear. We're going to wrap up a little bit at this time, but before we do that, I would like to hear from you. What would you recommend to people and families that's living with sickle cell disease?
I would really recommend that patients speak out about the disease and advocate to lobby their politicians. Currently, sickle cell disease, I think there's like 8,000 babies born every year with sickle cell disease. There's 100,000 approximately patients with sickle cell in the United States. However, cystic fibrosis, which there's only 2,500 babies born a year, is funded at approximate research dollars looking into a cure are about $2,700 per patient versus $345 for sickle cell. Wow. So there's a huge disparity.
Yes.
And patients need to advocate and make people aware.
Yes. So it's been great having you here. And one of the things I wanted you to just clarify just briefly is entitlements. What actually are entitlements?
Entitlements are a benefit, financial benefits in insurance that many patients are eligible for. Okay. So that could be assisting patients in getting on Husky or Obamacare. It can be assisting them with SSI, SSDI, Social Security funding, Medicare funding. It can be helping them navigate their insurance if they have both a Husky insurance and a commercial insurance, or a Medicaid insurance and Medicare insurance and a commercial insurance. So it's kind of assisting patients in accessing and obtaining the benefits that they may be entitled to or are entitled to because of their disability or their disease, and making sure that when you have insurance, it allows you to access the best medical care. It allows you to obtain your medications and stay on your medications. So it really helps patients in kind of maintaining that connection and taking the meds and kind of being able to get the treatment that's appropriate for their condition.
That's great. Well, we have run out of time, and I would hope and pray that you will be able to come and join us again, because I think there's still so much that you can share with us.
Well, thank you,
Virginia.
But I want to
thank you, Teresa Works, for being with us today. Today you have just witnessed again another great episode of hearing information about sickle cell disease. Right now, all we do have in terms of a cure, and we don't have a universal cure at this time, but we do have education, and we do have information that we can share with you, that you will become more aware of what this disease is, how it affects our community. So again, my name is Virginia Pritiller. I am serving as the Executive Director for Citizens for Quality Sickle Cell Care. We have a website, which is www.cqscc.org. Our phone number is 860-223-7222. And we do have 2 offices, one in New Britain and one in Hartford. We thank you so much for joining us today, and we hope that you will join us again in the future. Thank you.